The 15-minute or less lecture series, Human Anatomy, Chapter 18, The Brain and the Cranial Nerves, Part 2. The cerebrum. The cerebrum has an outer gray area called the cerebral cortex. It is made up of many rolls and folds that end up forming a very complicated wrinkle-looking structure. The folds, the regions that stick up, are called agyrus mini gyri, and the regions that push down in, the crevices, are known as the sulcus or sulci. And then you have an extremely large groove going down to the tissue that is referred to as a fissure. And then deep to the cerebral cortex is what is known as the cerebral white matter, which is mostly white matter. So here we can see that the cerebrum has two hemispheres, a right hemisphere and a left hemisphere. These hemispheres are separated by what's called the longitudinal fissure. And the two hemispheres are connected to each other by what is called the corpus callosum. So here's corpus callosum with a mid-sagittal cross-section. Here is corpus callosum with a coronal section. Each hemisphere of the cerebrum possesses 5 lobes, 4 of them superficial, 1 deep. The 4 superficial are the frontal lobe, which is anterior, the parietal lobe, which is superior, the occipital lobe, which is posterior, and the temporal lobe, which is lateral. Then, if you cut into the lateral sulcus, you will be able to find what is known as the insula. So the 5th lobe is the insula, lying deep within the lateral sulcus. So some specially named sulcuses. There's the central sulcus, which is the border between the frontal lobe and the parietal lobe. The strip of gyrus of brain tissue directly anterior to it is the precentral gyrus, also known as the primary motor area of the cortex, and is technically posterior into the frontal lobe. And then directly posterior to the central sulcus is the postcentral gyrus. Postcentral gyrus is also known as the primary somatosensory area of the cortex, and it is the anterior portion of the parietal lobe. There are various cerebral tracts within the white matter that help to connect different regions of the cerebrum. There are associated tracts. Associated tracts conduct nerve impulses between gyri of the same hemisphere. There's the commissural tracts. Commissural tracts conduct nerve impulses from the gyri in one hemisphere with the corresponding gyri in the other hemisphere, passing through the corpus callosum usually. And then the projection tracts. The projection tracts contain axons conducting impulses from the cerebrum to lower parts of the central nervous system, or from the central nervous system to the cerebrum. There are also some nuclei within the white matter of the cerebrum. They are known as the basal nuclei. These are 3 nuclei found deep in the cerebral hemisphere. There's the globus pallidus, as shown here, the putnam, as shown here in a coronal section, and the caudate nucleus. And these are very important because they help to regulate initiation and termination of movements, and also they are involved in some cognitive processes. Damage to the basal nuclei can lead to things like Parkinson's disease. It leads to an uncontrolled shaking and also rigidity from degeneration of dopamine-releasing neurons that enter the basal nuclei. Then there's Huntington's disease, a genetic disorder that leads to rapid, jerky, involuntary movements and also mental deterioration. It is often localizing damage and degeneration to the caudate nucleus and putnam. Then there are some cognitive functions that are linked to the basal nuclei. There's Tourette syndrome, involuntary body movements, and also involuntary verbal outbursts. And it's thought to be a dysfunction of cognitive neural circuits. There's schizophrenia, which can lead to delusions, distortions of reality, paranoia, and hallucinations. Thought to be also a dysfunction of behavioral neural circuits. And then obsessive compulsive disorder, where the person experiences repetitive thoughts that lead to repetitive actions. This is also thought to be a dysfunction of behavioral neural circuits. Limbic system. Limbic system is composed of structures that border the cerebrum and the diencephalon. The limbic system includes structures such as the hippocampus, very important for memory, the hypothalamus, which is very important for a lot of different functions, including rage, emotions, and then the amygdala, shown over here, which is important for rage and docility, and the olfactory bulb, which is important for olfaction, being able to detect smell. And the limbic system is important because it is thought to be where our emotions originate and how we decide on what sort of responses to have to those emotions. There's also clearly a memory link and olfaction. Sensory areas. There are various areas within the cerebrum that are where we receive sensory information. There's the primary visual area found in the occipital lobe, the primary gustatory area found in the parietal lobe, primary auditory area found in the temporal lobe, primary olfactory area found in the temporal lobe, and the primary somatosensory area found also in the parietal lobe, specifically the postcentral gyrus. The central area, sensory areas are pretty localized to where they are. The primary somatosensory area is especially interesting because if you look at that long gyrus lying along the cerebrum, you see that different areas of the body map to different regions of that gyrus. Basically, areas that have more receptors get a larger region of this portion of the brain, so that areas like the face, the tongue, the hand, they get very large regions, lots of receptors there. And areas like the arm or the leg don't get as many because they don't have as many receptors. And these receptors are for sensations like touch, proprioception, pain, itch, tickle, and detecting temperature. There are usually secondary sensory areas that help to integrate the sensory experience, make it meaningful. For instance, with the primary visual area, there's the visual associated area that lets you recognize what you see. There, next to the primary auditory area is the auditory associated area that helps you distinguish between sounds. And near the primary somatosensory area is the somatosensory associated area, helps us have memories associated with sensations and also is important for trying to distinguish things by touch alone. Then with the motor areas. Motor area is important for the outflow, the commands to control the skeletal muscles. The primary motor area is also known as the precentral gyrus, and it is involved in controlling the voluntary contractions of skeletal muscles. It also has an associated area known as the premotor area. This is where you learn your learned motor activities. Those memories are stored, so you're able to do those learned complex sequential activities like playing a piano, driving a car, shooting a layup. Other areas include Broca's speech area. This integrates and sends information to the premotor area to control the muscles for speech. So important for controlling the muscles for speech. Other associated areas include the Wernicke area. The Wernicke area, over here, interprets the meaning of speech by recognizing spoken words. So you know more than just words, but what those words mean. It's also a common integrative area that integrates sensory information, allowing formation of thoughts based on that sensory input. And then the prefrontal cortex. Some people might argue the most important part of the brain. It is where your personality is localized, where there are a lot of functions involving intellect, judgment, reasoning, planning for the future, abstract ideas are all pretty much localized. Hemispheric lateralization. Each hemisphere has its own specialized functions to some degree. Start off with, of course, the right hemisphere controls the left side of the body, left hemisphere controls the right side of the body. Right hemisphere is thought to be involved in things like musical artistic awareness, recognition of faces, emotional context of faces, general emotional content of language, discriminating against odors. The left hemisphere, on the other hand, is reasoning, scientific skills, the use of and understanding sign language, as well as spoken and written language. Alzheimer's disease, disabling senile dementia. Overall, what is happening is the brain is breaking down. There's a loss of neurons that liberate acetylcholine, which is a lot of them. There's a development of beta amyloid plaques outside of the neurons, and also neurofibril tangles and neural bundles of filaments inside the neurons. Concussion is another brain injury where basically it is when you temporarily lose consciousness from some sort of head injury. There's no obvious trauma to the brain. Contusion is when the brain actually is bruising. There's leakage of blood around the brain. The pia mater may be torn. Aphasia, inability to use or comprehend words, often from some sort of injury. Non-fluent aphasia, inability to properly form words. Maybe Broca's speech area is probably damaged. Fluent aphasia, faulty understanding words. You can say words, you just don't understand them. And this would be damage to the Wernicke's area. All right, cranial nerves. Cranial nerve 1 is olfactory nerve. It starts with the olfactory epithelium, where the receptors are actually the sensory neurons themselves. They pass through the cribriform plate, synapse in the olfactory bulb to carry the information on to the primary olfactory area in the temporal lobe of the cerebellum. It bypasses the thalamus. You have the optic nerve, cranial nerve 2. It is taking information from the retina and transmitting that information through the optic nerves to eventually reach the primary visual area in the occipital lobe. The two optic nerves join up together at what's called the optic chiasm and reorganize. Then they pass through the thalamus to the primary visual area. Anosmia, loss of smell, anopia, blindness, due to a defect in one or both eyes or damage to them. Oculomotor nerve, cranial nerve 3, trochlear nerve, cranial nerve 4, and abducens nerve, cranial nerve 6 all move muscles that move the eye. Oculomotor nerve is the most active. It ends up controlling superior rectus, medial rectus, inferior rectus, and inferior oblique muscles of the eye, plus the muscle that controls moving, lifting up the upper eyelid. Also has some autonomic functions for controlling lenses, eye, and lens and iris. Trochlear nerve controls the superior oblique muscle, and abducens nerve controls the lateral rectus muscle. So disorders from these being damaged: strabismus, lazy eye, one eye not quite focusing on the object; diplopia, double vision because the eyes are constantly trying to adjust because they're not lying upright; ptosis, drooping of the upper lid. This is only damage to the oculomotor nerve. Trigeminal nerve, cranial nerve 5, emerges from pons, has 3 main branches, hence trigeminal. Is a mixed nerve, sensory information for touch, pain, and thermal sensations coming from the deeper structures of the face, and motor functions for controlling chewing movements. Damage to this can lead to trigeminal neuralgia, where the sharp cutting or tearing pain caused whenever the trigeminal nerve is touched. There's the facial nerve. This innervates more the superficial structures of the facial area. It is a mixed nerve with sensory neurons for gustation in the anterior 2/3 of the tongue, since the taste for 2/3 of the tongue go through the thalamus to the gustatory areas of the parietal lobe. Motor neurons control structures in the middle ear, facial muscles of the scalp and neck. Also has autonomic functions, including control of lacrimal glands, nasal glands, and sublingual submandibular salivary glands. Vestibulocochlear nerve, cranial nerve 8, carries the information, the impulses for equilibrium, as well as hearing. Hearing going to the primary auditory area after passing through the thalamus. And look at that, it goes to the opposite side of the brain. Equilibrium disorders, vertigo, feelings if one's body or environment is rotating. Ataxia again, or nystagmus, involuntary rapid movement of eyeball. Auditory disorders, tinnitus and deafness. Glossopharyngeal nerve, cranial nerve 9, is a mixed nerve. Sensory information it carries includes the gustation or taste sensation for the posterior third of tongue, proprioception for swallowing muscles, receptors for monitoring blood and the chemical composition of blood, and also the external ears, touch, pain, and thermal sensations. It also has motor functions, the stylopharyngeus muscles allowing us to swallow, and the parotid salivary gland. Disorders include dysphagia, difficulty swallowing, aptilia, reduced secretion of saliva, and ageusia, loss of taste. Vagus nerve, cranial nerve 10, is the only cranial nerve to innervate structures in the thoracic and abdominal regions. Sensory, it brings in sensory information from all those various visceral organs, fullness, hunger, stress, discomfort. Also innervates structures of the skin for the external ear, touch, pain, and thermal sensations, taste buds in the throat, baroreceptors, chemoreceptors in the bloodstream, proprioceptors for the muscles of the neck. And it also has motor functions, controlling muscles for swallowing, vocalizing, coughing, and autonomic functions for all those various structures in the thoracic and abdominal cavity. Damage can lead to vagal paralysis, inability to receive sensory information from thoracic or abdominal cavities, dysphagia, difficulty swallowing, tachycardia, increased heart rate. Accessory nerve, cranial nerve 11, is a motor nerve that helps control the muscles for moving the head, including sternocleidomastoid muscles and the trapezius muscles, damage to lead to paralysis. And hypoglossal nerve, cranial nerve 12, innervates the medulla oblongata, originates from the medulla oblongata, innervates muscles of the tongue, controlling the muscles internal to the tongue. Damage to it can lead to dysarthria, difficulty speaking, and dysphagia, difficulty in swallowing. Like and subscribe below.